I'm Dr. Lincoln Parker. This is Dr. Tyler Hales, and today we're going to be talking about how you, the patient, can get the most out of your experience at your dental office. So, Tyler, talk to me about, patient walks in, what's your advice? What do you tell them as what they can do to get the most out of dental office?
Yeah, so most patients, they walk in and, let's be honest, most patients don't like the dental office. And that's usually the first thing they tell me, or they're very quiet. So the best patient that I've had is just one that's open. Like, they've come and they have questions. They kind of already know some things, but they want to know more. And so really, my job is then I can just help give them that information. You know, it's hard when I try to find out where they're coming from and what they want, and they just want a solution, but I want to give them really more information.
Right.
It's like, here's just telling them they have a problem. I want them to understand that, as opposed to just here's a filling.
Wait a second. You're telling me that you want the patient to understand their problem?
It's crazy, right?
Yeah. I mean, communication's hard in the dental office, right? Like, you have people that are experts that understand it perfectly well, right? Where we know exactly what's going on, why, we know solutions in our head, and then you take people that can't even see the problem because it's their upper right back tooth, right? And so then, they're at a loss for like, okay, I guess that's an issue. So, what I tell patients is, right, like, if you don't know, or if you're having a hard time getting what's going on, ask for more information, right? So, hey, can you show me that crack? Or can you show me that cavity? Wait, where is it again? But, asking questions, getting more information. As a patient, that's your number one resource to get more out of your dentist, or your dental hygienist, or the assistant, or the gals that sit at the front desk, is asking. Because, I want to help. I know you want to help. And most dentists want to help. And so we're total nerds about this stuff, right? We love teeth. That's kind of the weird part of who we are. But I tell patients to ask questions all the time. So in my new patient consults with my new patients, I tell them, your job is to ask me lots of questions, like, how soon do I have to do this treatment? Do I have to do this treatment? What if I don't? What if I don't want to do that? How much is it going to cost? Is it going to hurt? These types of questions help you build trust in your care provider, and then you feel more confident in whatever you want to do. And the dentist and the dental team should support you in that, right? I know we
For sure. Yeah, we do our best here to really be supportive. We always want you to feel really in control of when you're here, because it's your mouth. You should be able to know what's going on in it. We shouldn't be dictating this is what has to happen. It should come down to, what do you want to happen? Because that's going to be the best result in the end. You know your mouth the best. So, that's something that we try to do. And as dentists, it's hard. We're not taught that in dental school. How do we communicate best what's going on? And it's hard. So figuring that out, that's why our questions are really good, because then we understand where you're coming from and how we can approach the situation, and what our recommendations are based upon that. So,
yeah. So hopefully that helps you in understanding and feeling more empowered to walk into your dental office and say, okay, let me think about what questions I need to ask, or I need to answer for myself, so that I feel more confident and more in control, and feel better about whatever we're doing. So hopefully you find that helpful. Dr. Hales and I are going to continue to be doing videos like this. We're going to have to turn the air conditioning up higher, though, because these lights are really hot, and getting kind of sweaty sitting here underneath these bright lights. So anyways, thanks for watching.